is tonight.
I was having a heart attack at that moment, and I had no symptoms, no pain, no shortness of breath, nothing. It was quite shocking.
An ABC 27 special presentation.
I can sing, I can talk, I can walk. It's just amazing. I can feel my heartbeat normally. It's a miracle, an absolute miracle to be able to live again.
Heart to Heart, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. February is National Heart Month. Tonight, doctors from Penn State Health are here to tell us how we can get the health we need to live the way we want by keeping our hearts healthy. Heart disease is the leading cause of death for men and women in the United States. Risk factors are high blood pressure, high cholesterol, and smoking. Statistics show that about half of the men and women in the U.S. have one of these 3 risk factors. So how do we keep our heart healthy? How does diet and exercise help? What screenings are available? We will answer those questions for you tonight. And viewers have questions too. Denise McCracken is standing by with more. Hi, Denise.
Hi, Deborah. Yes, viewers have sent in questions. Tonight, Dr. Michael Farbaniak will answer those questions about the heart. And if you have questions, you can join the live web chat right now. Go to abc27.com/heart, and we'll be back later in the show to share those with you. Deborah.
Thanks, Denise. When we think of a cardiac event, we might picture what we see in the movies, someone grabbing their chest or an immediate collapse. That's not how it always happens. Here's the story of a woman whose heart incident was found by her family physician. Christina Butler reports.
I actually felt a little twinge or something, but I had a virtual exercise class I wanted to do, so I did it. And I felt fine the rest of the day and evening. I felt perfectly fine, so I didn't give it another thought. The next day, I awoke to some chest discomfort. Nothing like a lot of people say an elephant on your chest, or I had no pain down my arm. I had no chills or sweating or jaw pain, nothing like a lot of the signs that women get. I just had a chest discomfort.
Ann Erdl was feeling a little off, but not awful, when she went to see her primary care physician, Dr. Robert Mandel, last winter.
You try to think of, what is the worst case scenario? If I don't get this correct, what might I be missing? So, when she came in, one of the things you think about is this cardiac related? Noting that she had family history of heart disease, she has a personal history of cholesterol, that she possesses some risk factors that could have suggested that this was cardiac in nature. So you jump into action and you make sure that that's the case or it's not the case.
Dr. Mandel performed an EKG. It showed a difference in heart patterns, suggesting an acute heart issue.
In the moment, what was occurring is something that we call angina. So angina is chest pain that is caused by decreased or lack of blood flow to certain areas of the heart. She was experiencing that in that moment, which ended up leading to her chest pain.
Came in and told me that the changes were significant enough that I did have to go to the ER, and my husband was out waiting in the parking lot. He could not take me. I had to have my first ambulance ride. Went to St. Joe's Medical Center's ER.
Once she entered the hospital, the team had already contacted cardiology to let them know that she would be arriving, where she ended up getting much further evaluation and workup, and then eventually ended up being taken to the catheterization lab, where she ended up, getting full treatment.
A catheterization showed one artery was 95% blocked, another 65%.
I was 69 years old. I never had anything. I was, a pretty hale and hearty person, took good care of myself. So it was all shocking to me that this kind of kept unfolding, that I wasn't being sent home from the ER.
Her hospital stay wouldn't last long, though.
Within 24 hours, literally, everything was done. Everything was diagnosed. The catheterization was done. The stent implanted. I was home within 24 hours. It was unbelievable.
Ann chose to take charge of her recovery through Penn State Health St. Joseph's Cardiac Rehab Program. It includes diet and nutrition education, as well as strength and exercise.
You can do 2 or 3 times a week. I was comfortable with 2 because I had my own virtual exercise classes to do. So I went 2 times a week for 3 full months. And I can't say enough about them. The cardiac rehab, the 2 young women, Allison and Kelly, are magnificent. They're professional, but personal enough that you feel like it's home, and they have your best interests at heart, and they tailor the workout circuit to you with, isometrics and weights and gym equipment, and you do it at your own pace and on your own time. And it was absolutely wonderful. I can't speak highly enough about them or the program.
I would say that following everything that Ann has been through, that she's doing excellent. She continues to follow up with both her primary provider, who is myself, and then obviously her cardiology team. And we continue to control as a group her, we call them modifiable risk factors. So making sure that cholesterol, those blood pressures, that things are controlled, and that we are controlling the situation as best we can to maybe avert further issue.
With Ann back in good health, she's able to return to what she loves, volunteering with Meals on Wheels.
I get way more out of it than I give. It isn't just the meal that you deliver, it's the time that you spend with people. It's just so heartwarming to see how they feel when they get the meal, because it's, as I say, not just a meal. It's sometimes you're the only person they may see in a day's time.
Serving others while thankful for the service she got from Dr. Mandel and Penn State Health St. Joseph Medical Center.
A couple of things to note about Ann's story. One of the 2 blockages, one was treated with a stent, the other with medication. In her case, going to her primary care physician right away was the right choice. And joining us is Dr. Steve Ettinger, Vice President of Penn State Health Cardiovascular Service Line. Thanks for being with us.
Good evening, and thank you.
Ann is from the Reading area, and her story shows just how far you have expanded as far as your cardiovascular services at Penn State Health. Talk to us about that.
Yeah, the mission of Penn State and Penn State Health is to continually improve the health and well-being of our people of Pennsylvania and beyond. And so our community involvement and support in the Harrisburg metro area through Holy Spirit Medical Center and the recently opened Hamden Medical Center, our community support and involvement in Berks County with St. Joseph Medical Center, and soon our opening of Lancaster Medical Center in Lancaster County, along with the services that we provide in York Adams and Franklin County, really integrate fully with our academic medical center in Dauphin County, the Penn State Milton S. Hershey Medical Center. This integration of care allows us to provide high quality, compassionate care to our patients. It also offers the opportunities to participate in clinical trials to advance our knowledge and understanding of the diagnosis and treatment of medical conditions. And finally, it strengthens our communities by allowing us to educate, train, and many instances retain healthcare workers for the future, which are so important in the delivery of care.
Now, your mission is to bring life-saving cardiovascular care to communities where they need it, so no one really has to travel so far away from home. How are you all working together at Penn State to make that happen?
Well, we know how important it is to keep experienced, high-quality care local and keep patients at home. We know many times scheduling appointments or having to undergo procedures and studies, having to travel significant distances adds a complexity and alters the patient's experience. So making sure that those services are available in the communities that we serve is of our utmost importance. Also, when the complexity of the patient's condition warrants, full integration and coordination with an academic medical center that can provide that high quaternary service is so vital. It's important that there's sharing of patient's history, medical information, and procedures. And so when the patient is ready to go back to the community, that primary care provider has at the ready all the information and clinical plans of care for the patient to continue on in a healthy environment and lifestyle.
Now, Ann's story is pretty amazing. Everyone in the Penn State Health System really helped her, starting with her family physician. Why is it so important for people to get back to their regular screenings so they can prevent heart attacks?
It's so important that we follow behaviors that we know are heart healthy: diet and exercise, wellness checks, and screening. And we know also that during these past 2 years, the pandemic has profoundly interrupted that. And so we want patients to know it's important to re-engage with your providers. It's important to undergo and schedule screening tests, because the sooner we can identify any kind of medical condition or problem, the more timely the care can be, and the better the outcome that you'll have long term.
Yeah, thank goodness for all the screenings you have. Thank you, Dr. Ettinger, for all that information.
Thank you.
And for more information about Penn State Health, or if you would like to schedule an appointment, call 866-314-4158 or visit online at pennstatehealth.org. Now let's check in with Denise McCracken for the answers to some viewer questions that we've received. Denise.
Thanks, Deborah. Well, here to answer those questions is Dr. Michael Farbaniak, cardiologist at Penn State Heart and Vascular Institute. Doctor, thank you so much for joining us this evening.
Good evening. Thanks so much for having us, Dizzy.
And our first viewer question is about heart attacks. What are the symptoms of a heart attack?
Symptoms to watch out for typically are chest tightness and pressure. A lot of people don't even describe it as a pain, but more of a pressure sensation. And this can be coupled with arm discomfort, jaw discomfort, and shortness of breath. Typically, these symptoms will happen with exertion and get better with rest, but they can get more progressive and can happen at rest, and that can be very worrisome for a heart attack.
Our next viewer asks, I understand women sometimes have different signs than men for heart disease. What are they?
Thanks for asking. The difference between presentation between men and women is mostly in older patients, so greater than 65, while younger patients tend to have more classic symptoms. Women can present with very uncommon symptoms such as nausea, abdominal discomfort, shoulder, back pain, and no chest pressure at all. Sometimes even just a little shortness of breath alone without any chest comfort could be a sign of heart disease in women and in patients with diabetes. Unfortunately, sometimes these symptoms in women are often less attributed to heart disease. So 53% of women may have their heart disease missed, compared to only about 30% of men.
Dr. Farbaniak, thank you for answering those questions for us. We're going to be checking in with you a little bit later in the show. Now, if you have questions, you can join the live web chat right now. Go to abc27.com/heart, and we will check back in with you a little later in the show. Stay with us. We'll be right back.
This is Dave's piece.
Oh, that's what I'm talking about right there.
This is Dave's faith. This is Dave's second chance.
Try that again.
This is Dave's answered prayer. This is Penn State Health Heart and Vascular.
You're watching Heart to Heart on ABC 27, sponsored by Penn State Health.
Welcome back. Penn State Health is expanding its services throughout our communities. I spoke with Dr. Safwat Gassis, Medical Director of the Atrial Fibrillation Center at Penn State Health Holy Spirit. He talked about the heart specialists on the West Shore. Dr. Gassis, Penn State Health has an amazing team on the West Shore to treat heart conditions. Tell us what services you offer in Cumberland County.
So we offer the full spectrum of cardiac services. Our integrated system that involves multiple hospital facilities allows us to seamlessly provide any cardiac care in our community between Holy Spirit Hospital, Hamden, Hershey Medical Center, Lancaster, and Berks and Carlisle. So the full spectrum from preventative cardiac care to sophisticated cardiac procedures.
Now, you are medical director of atrial fibrillation. What is that?
So atrial fibrillation is actually the most common heart rhythm abnormality. So the heart has 4 chambers, It knows when to squeeze, when to relax. It's all very precisely orchestrated by the heart electrical system. So when the heart's rhythm is quivering instead of beating effectively, it makes the function of the heart become compromised. And that's what leads to symptoms. So the heart becomes very rapid and irregular, and a person can have a variety of symptoms, from shortness of breath to fluid retention to dizziness, chest pain, or passing out. And that requires treatment.
Yeah, and what types of treatments do you offer for that?
There are a variety of treatment options. Everybody is different, and the treatments are very individualized. So some people may do best with medications. Others may require more sophisticated treatment options, such as catheter ablation and cryoablation. Some people who may require blood thinners and are not able to tolerate those. We're also providing Watchman implants, which is a procedure that reduces risk of stroke without increasing the risk of bleeding.
Doctor, as far as atrial fibrillation is concerned, many of us have these latest watches. The Apple Watch actually tracks it. How accurate are they? And should we be concerned if it says we do have it?
Absolutely. We're certainly seeing a lot of technology out there that allows us to take more of an active role in our health. And these wearables give us feedback about our sometimes blood pressure, heart rhythms, and they're fairly accurate. So it'll tell you if there's noise or it's a real concern. And you can record it and take that information to your doctor and share it with your doctor. And then they can see it. And then from there can determine whether you need more testing. But absolutely, have a lot of patients who bring in those information from their watches, and it's very accurate.
And what other types of heart conditions do you treat at Penn State Health, Holy Spirit, and Hampton Medical Centers?
So we treat the full spectrum of heart conditions, anything from preventative cardiac care to coronary artery disease to heart rhythm disorders, sophisticated treatments such as heart catheterizations, stent implants, and ablation procedures for heart rhythm disorders, device implants such as pacemakers. And we also offer the Watchman implants, which is a device used to reduce the risk of stroke without increasing the risk of bleeding in patients with atrial fibrillation.
And Doctor, it's Heart Month. What message do you want to leave with our viewers tonight?
I'd like to take the occasion to remind everyone in our community to the importance of taking care of our hearts, preventing heart disease and treating heart disease in its earliest onset. So I want to emphasize that everybody should play this active role in maintaining and improving heart health. Know your numbers, blood pressure, cholesterol, blood sugars, and learn the signs and symptoms that it may indicate heart issues, staying active, managing our weight, and following closely with your primary care doctor to be able to catch anything early. Do not delay managing your heart health.
Yeah, that's certainly some great advice. Dr. Gassis, thank you.
My pleasure.
For more information about Penn State Health, or if you would like to schedule an appointment, call 866-314-4158 or visit online at pennstatehealth.org. Let's check in with Denise for some more answers to some more viewer questions. Denise.
Thanks, Deborah. Well, we do have a few more viewer questions for Dr. Farbaniak. Doctor, this viewer asks, what is the best way to maintain a heart-healthy lifestyle?
Well, the very best way to maintain your heart health is to be seen regularly by your physician. We're hearing a lot about that tonight. Keep track of your weight, your blood pressure, your cholesterol, and blood sugar, particularly if you have diabetes. By keeping these numbers in check, you can seriously reduce your risk of heart disease. Also, if you're a smoker, please quit smoking. This alone can reduce your risk by 25% or more. Also, doing physical activity every day and maintaining your mental health through stress reduction exercises can also reduce your heart disease risk.
And this next viewer asks, what should my resting heart rate be?
That is a very interesting question. So the normal resting heart rate can range anywhere from 55 beats per minute to 100 beats per minute. That's quite a big range. Normally we like to see lower heart rates because that does reflect cardiovascular fitness in a lot of patients. But that doesn't necessarily mean that a faster heart rate is dangerous. Now, things like smoking and excess caffeine use can increase the heart rate, and that is not great for cardiovascular disease risk. Also, a sedentary lifestyle and obesity tend to lead to higher resting heart rates as well. And that's something you want to avoid. So if you have lower or higher heart rates and have some symptoms of dizziness or lightheadedness, you may want to consult with your doctor. Also, make sure to keep yourself well hydrated if you feel your heart rate may be too fast, because that can also happen with dehydration.
Thank you, doctor, so much for answering our questions tonight. You've given us a lot of great information.
Thank you so much for having me.
And Dr. Farbaniak will answer your questions until 8. So if you have a question, you can join the live web chat right now. Go to abc27.com/heart. Back to you, Deborah.
Thanks, Denise. A Berks County woman never had signs or symptoms of heart disease. Lois Angela Santi was shocked when doctors told her differently. I spoke with her earlier.
Lois, what was your situation?
Well, I was 50 years old. I was at work. It was my lunch break, and I was getting ready to have ankle surgery, and I ran over to have an EKG done on my lunch break, and it turned out that I was having a heart attack at that moment, and I had no symptoms, no pain, no shortness of breath, nothing. It was quite shocking. It was quite shocking. So within 20 minutes, I was at Penn State in St. Joe's, and I was on the table having a cardiac cath done, and I was diagnosed with cardiomyopathy.
Wow, that must have been so unexpected, shocking, all of these things all at once thrown at you. What do they suggest as far as treatment?
Well, I was in treatment for quite a few years before my transplant. I was on different medications. I had a pacemaker, and eventually that wasn't enough. My heart was it was a very aggressive cardiomyopathy, and it went very, very fast.
What was your reaction when the doctors suggested you be put on the heart transplant list?
Well, I was put on the transplant list initially 2 years before my actual transplant, and at first you cry, and then I realized that if he leads you to it, God will see you through it. So I said to the doctor, I said, well, what do I have to do? Tell me what the next step is. And I took it from there.
So 2 years later, you get the news that a heart is available. Do you remember when that happened?
I do. I was really, really sick at that point. My heart had gotten severely bad. I couldn't walk a few steps without getting short of breath. I had trouble getting dressed, combing my hair. And when he told me that it was time, I knew it. I knew it was. And I kind of didn't think I would get one in time, but I did. It was pretty much a miracle.
Wow. And could you tell the difference right away?
Well, absolutely. I can sing, I can talk, I can walk. It's just amazing. I can feel my heartbeat normally. It's a miracle, an absolute miracle to be able to live again.
And it's now nearly 5 years since the transplant. It seems like you're feeling great. You look great.
Well, thank you. I do. I feel wonderful. I never really looked sick though, which is the weirdest thing with women. Don't be afraid, women. When you feel something strange, go get it checked out, because we don't get symptoms like men do. We don't get chest pain and all that. But I feel fabulous. I'm alive again. I have life. I hope a long one yet. I hope.
So the team at Penn State Health really made a difference for you.
They absolutely did. They were wonderful. I mean, wonderful. The doctors, the nurses, the coordinators, the transplant coordinators, the nurses on the floor that took care of me, the housekeeping, the kitchen staff. It was a joint effort. It is phenomenal. I was led there, and I know why now. It was great.
Oh, Lois, we are so glad that you're doing great, and we certainly appreciate you sharing your story with us.
Well, I thank you. Thank you that you're allowing me to do this. Thank you so much. Thank you, Penn State. Thank you. Thank you. Thank you. Thank you.
And joining us is Dr. Behzad Soleimani, Director of Penn State Heart and Vascular Institute, and Lois's surgeon. Thanks for being with us.
Thank you for having us.
Lois's story is incredible. She's doing amazing today. How does it make you feel to hear about her wonderful experience at Penn State Health?
Well, it's incredibly heartwarming, and it's such a huge privilege to be part of a team that has been able to help Lois and give her a second chance at life, and allow her to go back to her family and watch her grandchildren grow up. It's a tremendous feeling, extremely gratifying, and we're really, really privileged to be in this position.
And you talk about the team. How does your transplant team work together to have better outcomes for your patients?
This is a very complicated operation, complicated process, and to see a patient through from pre-transplant phase through the operation, immediate post-operative phase, and then to see them through 1, 3, 5 years in this case, takes an incredible amount of commitment and expertise from a lot of people that participate in this. And our philosophy and our approach is to treat our patients like they're our family and treat them just how we would like to be treated. And this patient-centric approach and a shared philosophy and vision of bringing excellence to our patients and doing our best for our patients is what underlies our success as a heart transplant program and really explains our outstanding outcomes in this treatment.
And speaking of the outcomes, you have some of the top heart transplant outcomes in the entire nation. Talk to us about that.
Yes, we're extremely proud of what we've been able to achieve at Penn State with our heart transplant program. You know, it's been a process, a building of a program that's been ongoing for a number of years to get us to where we are now. And again, it speaks to the commitment of everybody who's involved in this program, from cardiologists, cardiac surgeons, nurses, coordinators, dietitians, administrators. There's a whole host of people who have pulled together their expertise and commitment for us to be able to achieve this. You know, we're blessed to have one of the best results in the country and the best outcomes in the state of Pennsylvania.
Dr. Soleimani, thank you for that information tonight.
Thank you.
And we also want to thank Ann and Lois for sharing their stories and for you for sending in your questions. We also send a special thanks to all the healthcare employees who are working during this pandemic. If you would like more information or if you would like to schedule an appointment with Penn State Health, call 866-314-4158 or visit online at pennstatehealth.org. Now, February is American Heart Month, and we all know someone in our lives who has been affected by heart disease. For that reason, Penn State Health has launched a fundraising campaign called Give from the Heart to support advanced specialized cardiovascular care in the communities where we live, including right here in our own backyard. If you would like to make a gift to the Give from the Heart campaign, visit pennstatehealth.drive.com/event/heart month. And we want to thank you for watching tonight. We wish you good health.